I'm Jim Henderson with Dr. Granville Morse, and our subject at the moment is the fall flu season. I imagine you get pretty busy about that time.
Oh, yes, sir. That's always the busiest time of the year in the urgent cares. So once the flu season hits, it usually spreads like rapid fire, and we're always ready to go. We have our staff ready, and again, we're trying to get you the best medical service in a timely manner.
How do you determine whether you've just got a case of the flu or perhaps just a really heavy cold?
That's another popular question. So essentially, when you're dealing with viral infections, they tend to present in the same way. You get a little stuffiness, congestion in your nose, maybe a sore throat, fullness in your ears, cough, and you get achy. And when you combine those symptoms together, that's a virus. What separates the flu virus from the common cold is you typically have a high fever. You're looking at 103, 104 degree fever. Now, not all people with the flu have a fever that high, but that's a common indicator. If someone has that constellation of symptoms plus a high fever, that's going to be number one on your list.
Seems like you can get a flu shot at more and more places now. What's the advantage of getting it done at MHM Urgent Care?
Well, the great thing about getting an MHM Urgent Care, almost all the flu shots are covered by insurance now, so there's usually, depending on your insurance plan, nothing out of pocket, and no appointment is necessary. So again, you're able to get into the clinic on your time and get out of there in a very quick time as well.
When you do have the flu or a heavy cold, people say, well, take some chicken soup. Is that a placebo or does it really work?
Well, I mean, who's going to say their grandmother's chicken soup doesn't work? I would never say that. But the chicken soup, I think, does help. It's a broth that replaces your nutrients. Usually it's packed with vegetables, so that's good if you can get it down. The Vietnamese soup, the pho, is another great example of that, and that seems to give people relief.
But you don't know why, right?
Yeah, scientifically, I can't tell you why. Maybe it's just the love that they make it with. So,
well, they make great soups.
They
too.
really do.
Well, when you do have the flu or a heavy cold, people say, well, certainly you have to cover your mouth when coughing. Should you do so with your hand or with your elbow, as so many people do now?
Yeah, so really one of the more common ways to spread the virus is basically hand-to-hand contact. So if more people cough and sneeze into their elbow and wash your hands frequently, that would help diminish the spread of these viruses.
Dr. Morse, thank you so much. It's been a pleasure. I've learned a lot.
It was a pleasure speaking with you, Jim.